Welcome to Learn with Livanta, Medicare, the BFCC-QIO, and you. Livanta's podcast where we bring you up-to-date information about QIO services and the overall Medicare landscape. Livanta holds a contract with the Centers for Medicare and Medicaid Services as a BFCC-QIO, or Beneficiary and Family-Centered Care Quality Improvement Organization. BFCC-QIOs are contractors hired by Medicare to make sure that Medicare beneficiaries receive the care they deserve. All Medicare beneficiaries have a right to high-quality health care, and BFCC-QIOs like Livanta protect that right. There are three primary services that we at Livanta provide at no cost to Medicare beneficiaries. 1. Medical record review, which is when a beneficiary wants to appeal their discharge from a hospital or the termination of Medicare-covered services in nursing homes or other settings. 2. Medical record review when a Medicare beneficiary believes they received poor quality or substandard health care. And 3. Immediate advocacy, which is a service Livanta provides to help beneficiaries and their families when they're having problems with their care or Medicare-covered services. This month's episode is themed around our immediate advocacy service and the important work that caregivers do to support Medicare beneficiaries, as November marks National Family Caregiver Month, a time to recognize and honor family caregivers across the country. To begin, we're going to share a case study where these two topics are at the forefront, and then move into a guided panel discussion with Carmen Villegas and Christy Gibson, two leaders in our immediate advocacy department who work with cases every day. The true-to-life story that you are about to hear is based on stories of Medicare patients, families, and caregivers. The services that we provide at Livanta, including immediate advocacy, help to resolve barriers to care, inspiring hope and confidence that those in need can successfully navigate their care. Any resemblance to persons living or deceased is coincidental unless otherwise stated.
When my dad died a few years ago, Mom asked me to be her proxy on health-related matters. I have two brothers, but she and I have always been closer, especially when it comes to talking about medical topics. I agreed, of course. Initially, I really didn't have to do much. She handled making her own appointments and drove herself to them. I had access to her patient portal so I could stay up to date with everything. However, she began becoming confused more often, getting lost, forgetting appointments, and what the doctors had told her. I decided I needed to start going to appointments with her and becoming more involved. She had surgery a few months ago. Although it wasn't major surgery, she still had to spend several days in a rehab facility while she recovered. Mom started calling me in the middle of the night. She said that she was pushing the call button, yelling for help, but no one was responding. I called the first night and was able to reach someone at the nurse's desk. They assured me that someone had just been in her room to check on her. I called her back, and she said that wasn't true. It was the middle of the night, so I didn't rush across town at that time. She said it wasn't necessary for me to do that. I was still worried about her and went to check on her the next morning. The day staff didn't know what had happened, but said that a supervisor would come talk to us. By the time I left to go to work, no one had come. I was very frustrated at this point. That night, I received another call from Mom. She said that again she was lying in bed. She needed to get up to go to the bathroom, but no one was responding to her calls. I called the facility again, but this time I couldn't get through to anyone. I knew there had to be someone else I could talk to about this situation, so I started searching online. I found a phone number for complaints about Medicare covered services. I called and spoke to an advocate at Livanta. They explained that they could contact the facility for me. I quickly agreed to let them. I was trying to work and couldn't sit on hold waiting for someone to talk to me or keep trying to call all day long. Later that day, I received a phone call from the director of nursing at the facility Mom was staying at. She explained there was some miscommunication with the new employee, but that she had spoken with them about it. She also said she would assign someone else to Mom during the overnight shift. I still felt leery, but thought I should see if things were better that night. They were. I didn't receive any late night calls from mom, and she was in good spirits when I spoke to her the next morning. The Levanta advocate followed up with me the following day. I am so thankful to have had the advocate's help so mom and I could focus on her getting better and getting back home.
I'm excited to introduce to you Carmen Villegas and Christy Gibson, who we'll be speaking with today. Carmen is a registered nurse with over 24 years of healthcare experience in acute hospital care, skilled nursing, and physician clinic settings. Ms. Villegas is currently the Quality of Care / Immediate Advocacy Review Manager for the Beneficiary and Family Centered Care Quality Improvement Organization and is responsible for daily operations of beneficiary complaint intake, medical record review, and immediate advocacy intervention. Ms. Vegas is bilingual and fluent in Spanish and is a board-certified patient advocate. Christy holds a bachelor's degree in psychology and is a dedicated professional with over 15 years worth of experience in the healthcare industry. She currently serves as an advocacy supervisor and is responsible for assisting a team of patient advocates, committing to improving patient care through immediate advocacy, innovation, and compassionate understanding. I'd like to welcome Carmen and Christy to the podcast for a conversation about patient advocacy, caregivers, and the work that we do here at Livanta. I'd like to get us started by asking a broad question. What do we mean when we're talking about patient advocacy?
Patient advocacy is giving the patients and family the opportunity to express their concerns so that we can assist them in opening that door of communication, kind of a bridge between the healthcare providers and the family and patients.
In addition, we help patients navigate through the healthcare system and provide immediate assistance to meet their needs.
So, why is advocacy important for patients?
That's a great question. So some patients and or families, don't have that support system in place. Healthcare itself has its own language that can be complex and sometimes difficult to interpret. Patients and their families may have limited health literacy or don't understand how the healthcare system works. There are many questions that can result after encountering either a provider or when someone's in a hospital. And we all know how difficult sometimes that opportunity is in that window, how short it is to ask those additional questions. So it's important for patients and their families to have someone to help speak for them and give them that platform.
So, with that in mind, what does advocacy look like here at Livanta with the services that we provide for Medicare beneficiaries?
Per Medicare, immediate advocacy is an informal process that the QIO uses to quickly resolve an oral complaint. So within the process at Livanta, we make immediate or direct contact with a practitioner or provider in relation to a concern about the care. The immediate advocacy process is voluntary, and the QIO must obtain verbal consent from all parties in order to participate. There is no cost to the patient and their family for these services. Patients and their families speak directly to a team of healthcare professionals who are trained to advocate for patients and their concerns. We contact a provider directly, telephonically, to have them agree to participate within the advocacy process. Again, we also make sure to include family as much as possible and confirm that we're able to communicate confidential information in reference to the care.
What kind of scenarios are ideal for our advocacy service? Can you give us an idea of what issues a Medicare beneficiary could be having that could lead to using our immediate advocacy?
So there's a couple different departments. The appeals discharge immediate advocacy is once an appeals filed for hospital straight Medicare. Patient advocates will discuss with the family or their representative their concerns and questions regarding the discharge plan from the hospital when that occurs. It facilitates open communication. So if there's pieces of that discharge plan they don't understand, then we can reach out to that social worker or case manager, relay what they don't understand, and ask that provider to reach out to the family or the patient and a better overview, giving them a better understanding of what's happening. It gives them control and understanding of their healthcare needs and what's going on with that discharge planning. And that's specific to that department. There's also other departments of the media advocacy here at Livanta as well.
Yes, and thank you for that, Christy. In addition to patients who are under an appeal, we also offer these advocacy services for all settings of care for Medicare beneficiaries or patients. The different topics or concerns that a patient may encounter may be a follow-up appointment to discuss the results with the practitioner or the provider. Very often we hear about medication refills where they've seen the doctor and they were ordered a medication but are having difficulty obtaining it. We can quickly contact the provider to find out what's causing the delay. Referrals to a specialist for ongoing care, and additional questions that patients and or their family may have in the interim of a follow-up visit.
So, how does one initiate the immediate advocacy process?
So the patient or their family or caregiver, all they need to do is call the quality improvement organization. They express that they need an immediate advocacy and their concerns, and that will be got to the correct department. And then they'll start the process of giving them questions on what their concerns are and how Livanta immediate advocacy can help with that.
So, now that I've made this phone call, I've started the process. What does immediate advocacy, what does this process actually look like for Medicare beneficiaries and their families?
So specific to the hospital discharge appeals, we're speaking to the family or the patient right away after they've started their appeal. To inquire if have they already been given their discharge plan? Do they understand when they go home, whether it's home health care or if they're going to another provider, if those have been seamlessly addressed and they understand that process. It may be as simple as they don't know when their home health services are going to start, what date or time, or they don't know where they're transitioning to if they're going to another provider. So, in that specific department, we would gather questions on what they understand or what their questions are and concerns are so that we can better address that and make sure that the healthcare provider is giving them the full scope of information that they need. There's also the other department of media advocacy that I'll let Carmen describe.
Thank you. And again, all interactions from an advocacy perspective are telephonic in nature. So the caller, if it's the patient themselves or their family, would contact us, and everything is, verbally communicated to the provider. It's considered an informal process in order to find a resolution to address the patient and or their family's concerns. In addition, all parties must agree to participate in order for the concerns to be presented, and follow up from the provider. So for advocacy itself, nothing is, it's all informal. We do a lot of calling, to get either the provider on the line with the advocate and the patient and or their family themselves, or can call them independently and communicate back and forth in between that provider and that patient or their family.
Thank you both for really describing that process for us and our listeners. Like to switch gears just a little bit in our conversation. As I mentioned earlier in the podcast, November marks National Family Caregivers Month. Um, can you describe what a caregiver is and the role they have in a beneficiary's care?
And thank you for that. So for family members, to me, are vital to supporting patients, as they know patients best and what their needs and preferences are. So it's so important for us to always include caregivers. A caregiver could be simply someone who, not simply, but someone who gives direct care, or a family member who is concerned about a patient's well-being. So they come in all types of forms. Someone can be the one who's overseeing someone's direct care. Someone could be helping support coordinating that care. For For everyone, individualized care enhances a patient's experience as well as their own satisfaction with the healthcare system.
So why is this, and you alluded this to a little bit in the answer to this question, Carmen, but why is the topic of caregivers so important to us here at Livanta?
I know from not only a professional standpoint, but as well as a personal standpoint, it's so important to make sure that that patient's voice is being heard, that their wants and their needs are being met, and their preferences. Not everyone walks the same line. We don't all see and agree to the same type of healthcare. So options, you know, the different modalities available should be known that come directly from the patient or the family who is the closest to the patient and understands those preferences and those needs. So for me, it's so important for caregivers to be involved and also help the patient and the provider come to a clear understanding of what's to be expected.
So along those lines, how can a caregiver help a beneficiary with the advocacy process?
So the caregiver is providing the additional support, helping that patient effectively communicate their concerns, and it helps them to receive better, safe, and ethical care, ensuring they're treated fairly and with dignity. I mean, we all have parents and family members that do go through the healthcare system. And just like Carmen said, I would want to be treated fairly as well. When the caregiver contacts Levanta's advocate or any advocates, that goal is to help understand the issues, and having an immediate advocate can help spot the gaps and issues related to their care, promotes a higher standard of treatment and patient safety overall.
Thank you for that, Christy. And before we go, I'd love to ask just both of you if there's anything else that you'd like to mention or share with the people listening about either patient advocacy or immediate advocacy services here at Livanta or caregivers.
I think it's important for everybody to know that Levanta is here to answer questions as well as assist in the immediate advocacy and questions regarding the appeals. All of the staff is very understanding and helpful with any questions that they may have.
Everyone on from the healthcare professionals, we all can relate. We all have families. We're patients. We are within the healthcare system as well. So a lot of the team members really highlight and want to help the callers and or their families. The team truly strides in communicating and opening that line of communication with providers, bridging, as Christy mentioned, those gaps if there has been a breakdown in communication. Everyone is different. Our needs are different. Our wants are different. And sometimes it's so important to not feel like you're alone within the healthcare system. And you do have someone and a resource that you can reach out to help support you in that, continuum of care.
Thank you both for your time today. I know that this is not the end of our conversations about patient advocacy and immediate advocacy here at Livanta. Tune in next month for an episode focused on looking back at all the great work we've done here at Livanta this year. For more information about Livanta and to find your state or territory's helpline number, visit our website at www.livantaqio.cms.gov. That's www.livantaqio.cms.gov.